there's unlimited use. You know, for my clients that have this, because this is an at-home medical device, something the entire family can use at home. And what my clients are using this for is kind of like their new pharmacy. You know, light therapy helps the body to regenerate, repair, and rebuild, which is what we're designed to do. You know, unlike medications where it's masking the problems.
Today we have with us Cristina Pigeon. The light therapy has helped her so much that she decided to dedicate her life to it. Do you explain what light therapy is to all of us?
Absolutely. So light therapy has been around for over 35 years. This isn't a new technology. LEDs are light-emitting diodes, and they produce visible and invisible light waves, and it's delivered through a variety of different pulse frequencies. So the LEDs that I use, they're applied directly to the skin, which is really important. I'll go over later, but it's to stimulate a variety of physiological responses. And light therapy has been called several different things. Low-level light therapy, also known as LLLT, it stimulates the process called photobiomodulation. And that's kind of a mouthful, but to break it down in the science world, photo means light, and bio means living tissue, and then modulation means change. So it's the process of using light to create change in the body. Okay. So in light therapy devices, they are FDA cleared, as you mentioned, which is really important because it's a proven technology, you know, that shows the efficacy of the product, and it boils down to that, you know, it's also safe. So our FDA clearance is to increase circulation, reduce pain, reduce muscle spasms, soreness, and stiffness.
Okay. So tell me, how actually does light therapy work? Can you talk us through the process?
Yes, so it is very relaxing. I'll start with that. And it does put you into the parasympathetic state where we can heal. So it's great to do during meditations and just to get the body in that relaxed state. But treatment is 20 minutes. And I have the pads next to me so the viewers can see. They're just these neoprene flexible pads, and you literally can put them anywhere on the body. And so you don't just have to work on if you have pain or inflammation, but I'm always encouraging my clients to work on the lymphatic system, you know, work on the digestive, work on the kidneys, you know, you can even wrap the head for brain health. So there's a couple key things that happen when you do a treatment. So first, and I think it's the most important, is why do you want to do light therapy? It's because it releases nitric oxide from the mitochondria, which is the power plant of our cell. So nitric oxide is what's responsible for the vasodilation, the increase in circulation. And if you're not familiar with it, nitric oxide is a miracle molecule. And if you want to do a lot of reading, Google nitric oxide and the benefits, because there's, I think, over 70,000 articles on what nitric oxide can do for our body. And I'll name a few because I could go on for hours about this, but one is it helps to build new vessels. And it also helps with decreasing any type of swelling. It will help with lymphatic activity. It can help with memory and cognitive function. Cell regeneration, it'll increase. It will also help with the immune response. It can help manage diabetes by regulating the insulin. And I think one of the biggest questions that we always get is, can it help lower my blood pressure and my high cholesterol? And the answer is yes, and that's because of what the nitric oxide can do. And to really put it into perspective, though, you know, nitric oxide, as we age, we just become less efficient at the production of it. So they say that when we're 18, you know, we're young and healthy, we produce enough nitric oxide. By the time we get to the age of 40, we produce half of what we did at 18. And then by the time we get to the age of 60, we produce half of what we did at 40. So using this to slow down the aging process, because every time you do a treatment, you're getting those benefits of the nitric oxide. The other thing that it does is it increases our ATP production, which is a short term for adenosine triphosphate. And that is, ATP is responsible for increasing our body energy levels, and it can also assist with metabolism. So I think one of the main things that we hear from clients when they start doing treatments is they're sleeping better, and they just have so much energy, like they just, you know, they don't know what to do. And then, you know, ultimately with these things happening as you're doing the treatment, it increases circulation, which, you know, the benefits to that is decreased swelling, less inflammation. There's many detoxifying effects from this. It de-stresses the body, gets us
Hmm.
in that meditative state, and there's so much more. It all boils down to better circulation, better blood flow. It's not rocket science. We need
Okay.
good circulation.
Okay. And can you explain the different wavelengths?
What's the difference between this, and this? So I'll show you guys if you can see the pads here. So I got a blue pad and I got a
Hmm.
red pad. So the three different wavelengths that we use are blue, red, and the near infrared. Blue is
Hmm.
one of my favorites. So I'll just give some quick bullet points on what each of them will do.
Lovely.
Blue is a very calming light. I call it the happy light. So it's been known to assist with mood disorders. But what I love about it, so it only absorbs 2 to 3 millimeters, so it's on the epidermis, so it's more absorbed on the skin. So it's excellent for all things skin related, you know,
Okay.
fine lines and wrinkles, to acne, rosacea, eczema, psoriasis, cuts, burns, wounds. It also is kind of like an antimicrobial because it has those antimicrobial properties in it. So it's like an antibacterial agent. Red light
Hmm.
goes a little bit deeper. It goes 8 to 10 millimeters, and that's really good for soft tissue injuries.
Okay.
Now, the pads are paired with near infrared, and near infrared goes the deepest. Near infrared will
Okay.
penetrate to the bone. So it
Okay.
it can be highly collected on the bone. It'll even penetrate the skull, so it's excellent for anything brain related. Near infrared's invisible to the eye, so when you look at these LEDs, it looks like they're turned off, and they're not. They're on.
Okay.
But
Okay.
the near infrared is really responsible for the larger and the deeper vessels, and
Mhm.
for regeneration, cell function, nerve function.
Can you use them all in combination? So can you say that you used, if someone's doing a session, can you turn them all on at the same time on your pads, or are they different pads?
Yeah, there's a variety of different pads. So some pads are just red and near infrared, some are blue and near infrared, and then other pads we have all three wavelengths, and we call those
Okay.
our tricolor.
Tell me some of the success stories that you have seen with light therapy.
There's so many success stories. I could sit here all day with you to share the amazing ones that have happened right before my eyes. But I started using light therapy 8 years ago now, and I started using it for personal reasons. I was in a severe skiing accident, and I was suffering from a traumatic brain injury. So I'll keep it short, but we were in the mountain, and a guy took about a 20-foot jump. We were
Oh my
standing there.
God.
We were about to go in the warming hut, so we were standing.
Hmm.
But he came flying out of nowhere. He took a jump, and when he landed, he landed on my head, and he threw me
Oh
about
my God.
20 or 30 feet. So luckily, I don't remember any of this,
Hmm.
but I was knocked unconscious, and I think I was out for a couple minutes, and then I started going into seizures, and so they life flighted me off the mountain. So
My God.
yeah, it was, like I said, I don't remember any of it, but all of 2013, I was suffering from a traumatic brain injury. I had 3 months memory loss. I couldn't put any of my thoughts to words. I had notes in every room of my house because I couldn't remember from one room to the next what I was doing.
Hmm.
I had stuttering. Was angry, and
Oh gosh.
my vision was gone. I had 20/20 vision, and I had to get three different pairs of glasses because my vision was just torqued. But long story short, as I started doing the treatments, and I was doing so many things, let me tell you, I was doing, speech therapy, occupational therapy, hyperbaric chamber, you know, cranial sacral. And
Wow.
those things were helping, but friends of mine said, you got to try this light therapy. And I was like, there's no way this is going to work.
Hmm. Yeah.
And, within 2 weeks, my memory started improving, my speech started improving, and I got off of all my pain medicine. I was on Dilaudid, which is a form of morphine, because my head shocks were so bad. So they told me I wasn't going to recover, and
My God.
I fully recovered, and that's why I changed careers.
Amazing. What kind of diseases and ailments have you seen which have been helped by it?
Oh gosh, I work with, the simple back pain to arthritis, fibromyalgia, Lyme disease, lupus, dementia, neuropathy, the list goes on. And so I will say that there's so much research online for brain health and what light therapy can do.
Hmm.
And, because the near infrared penetrates to the skull, it's going deep in there, but you're getting more oxygen and blood flow to the brain. And, I've worked with lots of veterans, and we also worked with a company that does SPECT imaging that shows before and after scans, before light therapy and after, and they're showing it's a different brain. So
Right.
brain
Wow.
health in general. There's unlimited use, for my clients that have this, because this is an at-home medical device, something the
Mm-hmm.
entire family can use at home. And what my clients are using this for is kind of like their new pharmacy. Light therapy helps the body to regenerate, repair, and rebuild, which is what
Mm-hmm.
we're designed to do. Unlike medications where it's masking the problem. So,
Mm-hmm.
if you have a headache, take these pads and wrap your head. If you have digestive issues, put them over your digestive. If you want to boost up the thyroid, wrap your thyroid up. So it's kind of it's a go-to, as opposed to trying to mask it and band-aid it.
What is the difference between near infrared and far infrared?
So we get asked that a lot. There's benefits to both.
Mm-hmm.
Far infrared interacts more with the water of the body, so it's more of a heating and warming. It heats up the core of the body, like if you're exercising or if you have a fever.
Mm-hmm.
Whereas near infrared, it interacts more with the air in the body, and
Mm-hmm.
so it releases a significant amount of nitric oxide,
Okay.
whereas the far infrared would not.
Okay. What, if any, do you know are the side effects or dangers of using light therapy?
So again, this is an FDA cleared safe medical device. The
Mm-hmm.
only contraindications that we have are two things. Is one, if you're pregnant, don't put the pads over the abdominal area.
Mm-hmm.
And if you have a known cancer, not to put the therapy directly over the known cancer. So somebody who has a known cancer, that doesn't mean you can't use light therapy, because you can use it on all the other areas of your body to get, the benefits that we were just talking about. What I love about this is, you have the medical side, which is the efficacy, the FDA clearance, but on the other side of it, it's all natural, it's
Mm-hmm.
non-invasive,
Mm-hmm.
and you take these two worlds and you put it together, and it's functional medicine. And I'll
Yeah.
tell you, in the 8 years of doing this, people are searching for this, because not only is it natural and non-invasive, but because it works.
Mm-hmm.
So it's a beautiful thing.
Thank you. What research has been done, scientific research, to show that, this works?
So I like to use PubMed. It's one of the largest governing bodies for clinical research.
What was that?
PubMed, P-U,
PubMed. Okay.
PubMed, yes.
Okay.
There's over 7,000 research articles on PubMed, and it can be anywhere from cancer, it can
Mm-hmm.
be to retinal diseases, it can be to fibromyalgia, traumatic brain injury, arthritis. But there's a few different names for light therapy. So you
Mm-hmm.
can type in photobiomodulation,
Mm-hmm.
you can type in low-level light therapy, or LLLT.
Okay.
Um, you know, Light therapy is finally exploding. 35 years, it's not a new technology, but, some experts are predicting that by the year 2025, it's going to be a $1 billion industry. We'll say for all the ladies listening, and the gentlemen too, it's amazing for anti-aging and wrinkles. It's just, I tell my clients, look in the mirror before and look in the mirror after, and you'll see the vibrance. This is from the National Institute of Health. This is from 2008.
Mm-hmm.
The light therapy improves vision in patients with age-related macular degeneration,
Mm-hmm.
and it's showing that there's no side effects. And
Right.
that's just one example of the thousands of research that you can find there.
Can you tell us a little bit? So, if someone cannot get the pads, how would they get access to this?
So if they're local to me, I'll do sessions on
Mm-hmm.
them. But I work with clients all over. I have clients in Switzerland, Iceland, UK, and Canada. I'm located in the United States, but I work with clients pretty much, especially nowadays, over Zoom. And so when you own a system, you do get me with it. I educate you, and I constantly do education through webinars as well. We do webinars once a month. Again, this is an at-home medical device. That's something that you have in your home, but I work with you this way.
What home kits would you recommend?
There's two different controllers that we have. There's a 2-port controller, which you can have 2 pads. It's really great to travel with. And then there's the main system that's for at home, where you can have a maximum of 6 pads on your body at a time. And that is their most popular, because I'll tell you, it's not hard to find 6 areas on the body. So this is, I have the 2-port next to me. It's just this little controller that connects the 2 pads, and you can have it next to your TV. You can travel with it. It's really light.
Do you have to take several sittings?
Many clients will get instant results, but I always say keep in mind this is assisting the body to heal itself, and we all do that at different rates. Sometimes it may take more than a few sessions. Sometimes it might take a week or 2 or maybe longer,
Right.
but everybody's different.
If it's a longer chronic illness, does it take longer, or a chronic issue to be sorted?
It can. I mean, there's a lot of things that are go with this. It's, how healthy are you in general? How long have you been dealing with your injury or your ailment? Are you drinking lots of water? Do you eat well? But, this isn't an overnight fix. I always make sure my clients know that. You might, if you do get the instant relief, that doesn't mean that you're regenerated. Regeneration takes time. But I did, as far as vision, I've had people that have done a treatment, and I mean, right when they're done, they're looking at stuff and their vision has already improved. That takes time though.
That's lovely. For people who do not have these pads, or, I mean, just if you give people an idea of cost of the pads, and also tell people if they cannot afford to get them, how do they get access to this treatment?
So the prices range anywhere from $1,100 up to $5,000. That's based on US dollars. We do offer financing as well. As far as maybe somebody in your area, because there's a lot of clinicians and doctors that use this. I work with many practitioners and doctors and I help them to implement this in their practice. So you can see if somebody's near you. I think the key with light therapy is doing it consistently. And that's why having it at home, it is an investment, but it's something that you have for the rest of your life. And the more consistent that you are, that's where the magic starts to happen. And that's when you start to see things shift and the body start to heal. So my advice to you is that if you do go into a doctor's office to get light treatment, try to do it back to back so you can really give it a shot.
Can it help with osteoporosis?
Yes, it can help with the symptoms related to that, which is, the pain and inflammation. And again, goes back to increasing the circulation.
Okay. Well, tell us about how it helps with hair and face and skin and wrinkles.
Yes, but as far as for hair growth, red light therapy, there's lots of research on PubMed on how it can stimulate hair growth. And you can't really see them, but I wrap my head and I have all these little baby hairs coming out. I have to really get those down because it really helps with the growth. But as far as the skin, so you take one of these blue pads, and we have an anti-aging setting on one of our controllers, and you literally just put it over and you just do a 20-minute session, and it helps with the elasticity, the collagen. There's no near infrared in the face mask. That's the only pad we have that doesn't have near infrared, but that is what you need for fine lines and wrinkles. That's for the meditation. That's really to put you in that relaxation state. So you can put the face mask on, and you can do your chest wrinkles. You can do your, here or anywhere on your body that you want to improve the elasticity.
Tell us a bit about how it's helped with pain.
Pain is because of the increase in circulation and because of the nitric oxide being released, again, from the mitochondria. Nitric oxides are natural morphine. That's our body's natural morphine. So when that's released, there's a lot of magical things that happen. And again, Google nitric oxide and the benefits of what it brings.
Okay, that's lovely. Thank you, Cristina. Thank you for listening to this chat. If you enjoyed it, please subscribe to this page. Please subscribe to our podcast on Apple and Spotify, Wellness Curated, and follow us on Instagram, Wellness Curated, the number 1. Thank you.